head of the Africa Centers for Disease Control and Prevention, CDC, has said the agency is likely to declare a continental public health emergency over the growing Mpox outbreak. The Africa CDC's Director General, Dr. Jean Kaseya, said on Thursday that because of the increase in Mpox cases and its continued spread across borders, he had resolved to start active engagement with African Union member states to prevent the outbreak from becoming another pandemic. We are committed to mobilizing resources and providing technical assistance to affected countries to control the outbreak, said Kaseya. A total of 887 new confirmed and suspected cases of Mpox have been reported on the continent this past week, pushing the year's total to 15,132. According to data presented at the briefing, the cases have increased by 160% compared with the same time period last year. 16 countries have reported cases of the disease so far, including the Democratic Republic of Congo, which has more than 90% of them, and 461 people have died from it this year. Some countries, Burundi, Kenya, Rwanda, and Uganda, have reported it for the first time ever, Kaseya said. This new incident demonstrates the need for a collective and collaborative approach in curbing the spread of the disease, he added. Kaseya's announcement came a day after the World Health Organization Director General, Tedros Adhanom Ghebreyesus, said he would convene an emergency committee to determine whether the spread of Mpox on the continent should be declared a global emergency. The process of declaring a continental public health emergency entails technical and strategic consultation between the Africa CDC, which is an agency of the 55-member African Union, and affected member states. An extraordinary summit for heads of state follows to discuss a response. Mpox is a viral disease that causes painful rashes and flu-like symptoms such as fever, headaches, and body aches. The virus that causes it comes from the same family as that of smallpox. It spreads from person to person and from animals to people through direct contact. In May, scientists reported a new strain of the virus in the DRC that they said was more virulent and might spread more easily. First recorded in a human in 1970 in what is now the DRC, Mpox was declared a global emergency in 2022 when it spread to more than 70 countries. While countries in the West have controlled the spread of the disease through vaccines, Kaseya cited their shortage in Africa as a major challenge in controlling its spread on the continent, saying there were only 200,000 doses available compared with a demand of at least 10 million. He said Africa CDC was working with international partners to secure more vaccines. Last week, the AU made an emergency approval of $10.4 million, £8.2 million, to Africa CDC to support efforts to combat the Mpox outbreak. This is what we're up against: bad actors spreading disinformation online to fuel intolerance. Teams of lawyers from the rich and powerful trying to stop us publishing stories they don't want you to see. Lobby groups with opaque funding who are determined to undermine facts about the climate emergency and other established science. Authoritarian states with no regard for the freedom of the press. But we have something powerful on our side. We've got you. The Guardian is funded by readers like you in Bangladesh, and the only person who decides what we publish is our editor. If you want to join us in our mission to share independent, global journalism to the world, we'd love to have you on side. Geneva, AP. The head of the World Health Organization said Wednesday he will convene an expert group to determine if the increasing spread of the Mpox virus in Africa warrants being declared a global emergency. At a press briefing in Geneva, Director General Tedros Adhanom Ghebreyesus said that given the increasing spread of Mpox cases beyond Congo, he has decided to ask independent experts to advise who, as soon as possible. Last week, the Africa Centers for Disease Control and Prevention reported that Mpox, also known as monkeypox, has now been detected in 10 African countries this year, including Congo, which has more than 96% of all cases and deaths. Compared with the same time period last year, the agency said cases are up 160% and deaths have jumped by 19%. Officials at the Africa CDC said nearly 70% of cases in Congo are in children younger than 15. Who also accounted for 85% of deaths. Mpox was reported last week in Burundi and Rwanda for the first